Hi everybody, San Antonio Cosmetic Surgery. It must be Wednesday, and from the one token Jew in the practice, let me say to everyone, happy Ash Wednesday. Is that the appropriate thing? So happy Ash Wednesday. Today, we are going to discuss a liquid facelift. What's a liquid facelift? So Cynthia, our fabulous expert nurse injector, is going to walk us through the different components of what might be considered a liquid facelift. We have patients that, for one reason or another, are either not quite ready for surgery, they may not want surgery, or they're sort of in that in-between zone, and we have an array of some fabulous products that we can do here in the office to really jumpstart the facial rejuvenation process. And Miss Cynthia is going to walk us through that. And so I bid you goodbye. Have a great, great week. Cynthia's going to take it from here. We're very excited, and please come and join us in person here at San Antonio Cosmetic Surgery, practice of Dr. Delio Ortegon and myself, Michael Baumholtz, and come and learn about the liquid facelift. And so take it away, Miss Cynthia. Thank you very much. See you all soon. Have a great week.
All right, today, hi everybody. Happy Ash Wednesday, like Dr. Baumholtz says. Just want to introduce to you today what I'm going to be doing is what we kind of call like a liquid facelift. It's one of my treatments that I can do all in one at a time. I can actually treat a patient in multiple areas. With here, my patient and my co-worker, Nora, I'm going to treat different areas for her today all at once. I'm going to be able, I kind of did a little map for her. So I'm going to be treating her nasolabial folds with Juvederm. I'm going to do a little bit of Voluma in her mid-face for her cheeks. I'm going to put a little bit of Volbella under her lower lids, and then a little bit of Botox on the top. So it's going to be what I call a liquid facelift because I'm going to be able to enhance all the areas where she's slightly deficient, just slightly, and she's going to be able to do it all at the same time. Also, as you can see, she's holding on to this ice pack. I'm going to add a little bit of Kybella under her neck just to kind of soften up the transition from her chin, to her cheek. Just a little fullness there. I'm just going to dissolve a little bit of the fat there. What I'm trying to accomplish is to let you know that all of these treatments can be done at once. Doesn't mean like, oh, I'll do my cheeks and then I'll come back 2 months later and do my nasolabial folds, and then 2 months later come and do my Kybella. It all can be done at the same time safely as long as you're healthy, not taking any blood thinners, not on any medication that I would worry about. 2, that you're motivated to go maybe a little downtown with your chin. Nowhere else do I usually see any type of bruising or swelling. Patients do really well, and no exercising for 24 to 48 hours. So this is my map of what I'm doing for her. I have a picture if I can get that from you. So this is a picture of Miss Nora beforehand without any makeup. Here we go. So these are the areas I'm going to be treating again. Her mid-face, nasolabial folds, a little bit of her chin right there with Kybella, possibly a little Botox on the top and around her eyes, okay? Will you turn on the light for me, please, up here on this side? I'm going to turn on the light because I like to give everybody a suntan when I do this. Right there. All right. There we go. Got it? All right. So, bright light is for free, Miss Nora, okay?
All right.
Tanning is for free. All right, here we go. So for her, what I'm going to start off with is I'm going to start with her Juvederm. Why? Because that actually is where I give my structure for her right in this area. Very easy for her to tolerate and quick to see the results. So I've already numbed Miss Nora. I've already started my numbing process. I mapped her out, and here I go. You okay with that? Yes, please, if you're okay with that.
And please don't forget to like, share, any kind of comments or questions you have. We'll be happy to answer them live here with Miss Cynthia here at San Antonio Cosmetic Surgery. Our number here, if you have any questions, is 210-614-4320.
Thank you, Miss Amy. I like that. Okay, so this is my first area of treatment. I'm going to treat her nasolabial folds. And I like this because this actually, when I inject, you see instant gratification for the patient. They're able to see some of these lines just instantly disappear and shape this area, the loss of fat. Here we go. How are you feeling, Miss Nora?
Fine.
Any pain? She's a great patient. You see how that softened her up already? Just that little bit on that one side.
You can tell the difference right away from one side to the other.
And again, this is Nora's first time ever getting filler.
Okay, so As a first-time patient, she's very comfortable, I would believe. She's not jumping out of her skin or
Not at
anything.
all.
She's just very relaxed.
Yeah,
for
I
me.
am
Okay.
relaxed.
So that's the one side. A little bit of bleeding, nothing that would scare any of us. But do you see how it just softens up the transition for her? There we go.
And Cynthia, how do you decide what filler, out of all the different fillers you have, to use in what areas?
Okay, so every filler I have, every hyaluronic acid has an indication for where it's placed. So my Ultra Plus Juvederm is going to be for her nasolabial folds most of the time. I also use that for my lips. Voluma, we know it's indicated for the mid-face. All right, and then Volbella is indicated for the lips, and I do what we call the tear trough area. All right, here we go.
And these are all dermal fillers with the Allergan family. Allergan makes Botox, dermal fillers, and implants, breast implants, both in saline and silicone, and also the 410.
So I want to give her a little bit more peak right at the corner. As you can see how nice it's just softened the transition for her. A lot of people say to me, God, people always say I'm mad or I'm upset, and some of these lines, these commas, tend to drop our face a little bit. So here I'm giving her back some of the fullness she's lost with either age, weight loss, whatever it may be, but we're going to bring it back with a little bit of the Juvederm. Okay, there we go. Right there in the corner.
And how long do the Juvederms last?
This product is going to last her a year.
Is there anything that the patient should do before considering Juvederm or before they come in for their treatment?
The only thing I require is that you stay off anything that contains aspirin or ibuprofen, Aleve, fish oil, anything that's going to thin your blood. That's the only thing that I require.
And why is that?
Because it thins your blood. So it makes you bleed and have bruising. Okay, there you go. And I'm just going to go and hit this one spot over here where I see just a little bit more.
And right now we're currently offering $200 off all our fillers. So take advantage of that. That's running through the end of March. We also have our Botox $50 rebates, instant rebates at $11 a unit that you get $50 now and $50 off your next treatment for next time. So that's $100 savings. And of course, we accept brilliant distinctions.
So I'm able to get that softness now for her in her nasolabial folds, these nice little lines. Now I'm going to go to her mid-face.
Now, they had a question. They
Sure.
wanted to know how many syringes to do her smile lines, her commas.
Everyone's different. I must actually say that I would love to see my patients and give them a estimate of what they need. For her, that was one I used there, and I was able to give her half and half on each side. I basically was able to enhance from the base of her nose to the corner of her mouth, base of the nose to the corner of her mouth.
With just one syringe?
With one syringe for
One
her,
syringe.
yes. Mm-hmm.
Okay, and now you're moving to the mid-face, which
yes.
you're going to use which filler?
Voluma.
Voluma.
So this is going to give me a little bit more of a pickup. I'm going to go straight down. Feel that, Miss Nora? Are you okay?
Oh, I'm fine.
Okay.
Awesome, Nora. And this is Nora's very first time, and she's getting the full works. The liquid facelift.
I'm trying to do is, like I said, I'm trying to give her a little bit more of a pickup at the mid-face. Give her more of this cheekbone that she's lost with maybe a little bit of weight loss or change in structure. Because as you know, we lose fat. We lose fat, we lose muscle, we lose collagen. So what I'm trying to do is just build a little bit back. Nothing that's going to distort her look, just going to soften and enhance what she already has. Here we go, one more time. And most of my patients with Voluma really like it because they think, wow, this gives me instant gratification, gives me a nice little pop-up, changes the structure. I think patients really love this procedure at night when they go out afterwards. They see the instant gratification, but by this evening, if they go out to dinner, they're like, wow, I really like how my blush looks or how the picture I take. now of my selfie just changes.
Right.
So you see how it just gives me more of a contour and wraps around nicely. Now I'm gonna go a little bit mid. All right, here we go.
Now, how long does the Voluma last? Because it is a little bit longer of a duration than the filler on the commas, on the smile lines.
Yes, Voluma is going to last 2 years. That is all our studies show at this time. Voluma is a longer lasting product. It's a little bit more what I call cohesive, so it gives me a little bit more of the pop, a little bit more of the apple cheeks that I bring back in my patient. There we go. So you probably already can see that nice transition for her. The shadowing, you see where she's a little bit flatter on her left side. Now I've got a little bit more of my pop on the right side. It's going to enhance her cheeks, going to enhance the transition between her lower lid and right at the cheekbone area. How do you feel, Miss Nora?
I feel just fine.
Yeah? Not hurting you?
No, no pain.
Perfect.
And today we've addressed the smile lines. We're going to be addressing the mid face, the Kybella under her chin.
That's why you see her holding onto her little ice pack. There we go.
And this can all be done in one day.
Exactly. That's what I'm trying to educate patients today, that most of these things really have minimal downtime other than no working out today. That's the only thing. And I know Miss Nora and I were talking about her workout, how good she's been about working out. So today she's going to stay away from her workout.
Have a good
Tomorrow she
excuse.
can go back to it without a problem. But
And
for-
smile again, Nora. You can see how the apples of her cheek on that one side that was injected has definitely enhanced immediately.
Definitely. This is nice. I like the way the transition now hits in her cheekbone right there. Just gives me a little bit of a pop for her. It won't give me, a lot of people will ask me, is this going to make me look kind of robotic, like where it's just a real chiseled? No, it's just a softness. We start to lose this actual nice little cheek, apple of our cheek. I'm bringing it back to you, Miss Nora.
Yeah, you can already see the softness in her smile lines. Those kind of popped right out. There's less shadowing around her mouth. So far we've done one syringe for the smile lines, the commas on the sides of her mouth. And then we did one syringe on the cheek. Is this her second
This
syringe?
is her second one. I'm going now to my second Bobella for her.
Okay. And that spray that Cynthia's putting on, because she likes to pamper all our patients, is Pain Ease, which is just kind of a numbing spray. But she had
There we go.
already put a numbing
Cream on her,
Cream on
yes.
her.
And I had her sit here for maybe about, what do we think, Nora? 10, 15 minutes?
About 15 or 20 minutes.
Now, all our fillers are $200 off this month till the end of March. $200 off, and we do honor any Brilliant Distinction points, which Allergan offers to all their patients who.
Participate with Allergan, and we do all the work for you. You come in, the girls up front know the system very well. We'll get you registered. If you have points, we'll get your points started. We'll do everything that is required to get your points and get you going. So see how nice and soft that does her transition right in there.
Yeah, we love to make sure all our patients are taking advantage of all the offers provided by Allergan. So call our office. There's only a limited supplies of these rebates for Botox and instant savings on the fillers. So you definitely need to call the office to reserve yours while supplies last. It is only till the end of March, and Cynthia's pretty booked up, but if you call, we can definitely find time to get you in just in time for spring break.
Definitely. Wow, this looks really pretty, Miss Nora.
Yes.
Thank
Very,
you.
very, very nice. Okay. So look at her right now. You can see now where the shadow will hit. I'm sorry. You see the shadow of now from the top. It just gives me a nice little soft look for her.
Yes,
Nice
very
transition,
soft.
You know, and it wasn't something tragic for her. She actually tolerated very well. She still has a smile on her face.
We have a question from the audience. We welcome walk-ins, but usually if you walk in, you may have to wait to see when we could get you in the schedule. Your best bet is to call the office and schedule an appointment. We usually can accommodate everybody on their day requested.
Okay, there we go. So now I'm going to go to my other area of concern, which is going to be a little bit under her in the tear trough areas.
Okay, now we're moving to Volbella.
Volbella, this is the other one. Okay, the other product, which is very soft, easy to work with. It's going to allow me to give her a little bit of volume back under her lower lids, or what I call her tear trough area. Okay, it's going to just soften up that transition, okay?
Okay, you can see the side profile. Open your eye, Nora. Okay, when she does the Volbella in the tear trough area, you'll be able to see a little bit of volume placed there. You can already see, smile a little bit, the volume in her cheeks. She's got fuller cheeks that give her a more youthful look. And her smile lines have softened significantly. She's got an ice pack on her chin, preparing for the Kybella. Can you move the ice pack? You can see that we've gridded her, and we're numbing it with ice. So when we inject the Kybella in there, it'll shrink that fat pad down there and tighten the skin under the chin.
So now here we go.
And I'm going to show you this front profile. And then when she's done, we'll show you her before and her after. And you can see that it's immediate gratification. She's going to be able to go out tonight, stay upright for 4 to 6 hours.
But she will, because she's working here.
Yeah.
She's not going anywhere. Okay, relax for me.
Yes, Nora's our lovely surgery coordinator. So you'll be seeing a lot of Nora.
So here we go. Okay, Miss Nora.
Okay.
I'm going to feel a little bit right there.
Between Volbella. Now this is Volbella in the tear trough area for Nora.
So what I'm trying to accomplish is just make sure I have a nice transition from the lower lid to the cheek, where she's lost a little bit of the fat right there. Okay. It's not a lot, it's just enough to kind of just give me back the bounce from that tissue, the bounce of the...
And how long does Volbella last?
Volbella's going to last her a year.
A year.
So she's going to get nice timing with this. There we go.
And you can already see it's kind of filled in that hollow area. And it actually will help in taking away some of the discoloration, because the skin stretches out a tiny, tiny bit.
There we go. Just a little bit of
And
soft
you can
transition.
See this side. See, on this side, no Volbella. And on this side, she has Volbella.
There we go. So again, it's just a little bit of the transition that we've lost. That fat, we want to make sure we regain it, make her look a little bit more youthful and relaxed. A lot of people will say to me, oh, everybody tells me I look tired, my lower lids. Well, that's what I'm bringing back. I'm trying to get that youthfulness back.
And again, this can all be done in one session. We are offering $200 off all our fillers for this month till March 31st, but you need to call in to reserve your rebates. And our Botox is $100 off at $11 a unit till March 31st.
How do you feel, Miss Nora?
I feel fine.
Good. So this is definitely going to give her a little bit softer look for her, a little just more relaxed, refreshed, as I like to say. Am I hurting you in any way?
No.
You keep smiling.
It's because my bottom part of my face is numb.
Oh, okay.
She's got the numbing cream and
Yes.
the spray, and we got her nice and numb, so she's not feeling any of these little tiny pricks.
There we go. Perfect. A little bit of softness for her there. All right. Now,
And that was one syringe
that
for
was
both.
one syringe for both, because she had just a little bit
See
of
the
loss.
side profile?
Just a little bit of loss on her tear troughs.
Take the ice pack
Not
off
too
again.
much.
And you can see here, and if you look down a tiny bit, but yeah, with your chin, so we
Oh.
can, yeah, not. You can see that that's what we're going to address with the Kybella.
Okay. Now I'm going to come back at her right here, and one of the things I do like to work. So now if you look at her lip, she's got beautiful bottom lip. So what I want to do is I want to show just a little bit of the top of her lip, not to make her look very exaggerated, but just to bring her smile up a little bit and balance me out completely. Yeah, so as she, see how she drops her mouth here? So what I'm going to do is I'm going to bring her up like that with a little bit of Judah.
So when she's relaxed, she won't look like she's frowning or grumpy. We turn the frown lines upside down.
That's right. Ms. Jen, do you mind bringing the table up for me for just a little bit on the other side?
Absolutely.
Thank you. And so here we go. So again, I'm going back to my Juvederm product right in the corners of her mouth, and I'm going to bring her up just slightly. See, I'm going up. Okay, there we go. So you see how that picks it up just a little bit? I'm going to add a little bit of volume in the corner right there. You see how now, if you see the transition, right there compared to there.
Okay, let me show them.
Okay.
Let me just scoop
Arrow
the chair
up.
up.
Thank you.
More?
That's perfect.
Okay.
Okay, you see the difference? Where here she tends to drop a little bit more. Now I've picked it
yeah.
up a little bit.
For
That's all I'm
sure.
trying to do. Just make her. I know she's happy. I know Miss Nora's happy.
I'm thrilled.
So that frown is not.
And that's a great visual. And again, immediate gratification.
Definitely.
You can see
There we
how
go.
one side of her mouth droops more than the other.
Like I said, I'm just trying to add a little bit of volume to this upper lip. Not too much. I'm not trying to make her, give her a big fat lip. I just want her to balance out. To balance out nicely, softly, give her a little bit, and show a little bit more of the pink. Just see, it's not, there you go.
Feel free to call our office at 210-614-4320 to ask any questions or reserve your appointment slot with Nurse Cynthia or reserve your rebate with our fillers and Botox.
Okay. How are you doing, Miss Nora? You okay?
I'm doing good.
Okay. Again, I'm going to just give the corner a little bit of a pop, bring it up, enhance it, give the volume that she's lost right there. Add just a little bit on the corner.
Oh yeah, you can see how that straightened it up.
Bring a little bit of the corner of her mouth. See now how she's got a little bit more of a balance on her lip. And so it's a balancing act. We want to do the corners, drop it up a little bit. No more frowning for her. Even though she doesn't frown, she's very happy. Just a little bit of the loss of the volume in the lip makes a huge difference for her. You know, like I said, she has a beautiful bottom lip. I wanted to balance it out with the top lip.
And you can see as you fill some of those creases, her face brightens up. There's less shadow casting on her face.
Definitely.
It brightens her skin. And we always recommend sunscreen and a good skincare product regimen. You know, you invest with filler and Botox in your face, you want to take care of that skin.
Perfect. Now, we've kind of done a little bit of everything now. My last treatment is going to be my Kybella. Again, this is going to be quick. Why? Because I'm going to inject, hold on for a second, I want to wipe her so you all can see the nice transition in her. Very, very little bruising, very little, if not any bruising at all.
Let me show you real quick. Open your eyes, Nora, because I'm going to show them your picture, the before. That's after, and here is the before. See the shadowing of her eyes and her frown lines. This is before, right in here as well. And if you can make the same face there, and this is
I'm
the
changing my
after.
gloves. Sorry.
Yes.
I'm going to change my gloves a
Less
second.
shadowing, glowing skin. That was going to be mid-face Voluma, Volbella and the eye troughs, and Juvederm,
Okay.
Juvederm and the smile lines.
So I've gridded the area right down here, as you can see. I want to focus right in here. So a lot of people think, oh my God, Kybella is going to be for my whole entire jaw, everything. No, it's going to be for this area right here where she has fullness. I want to concentrate on her to thin her out so when, bring your chin down, when she comes down here, I lose some of this right there.
Or when she texts. We all text, we all text on
Absolutely.
our phone,
That's
and
it.
we get that text chin that's so beautiful.
All right, we're going to get rid of it, Miss Nora.
And I don't think all the jogging in the world is going to get rid of that. It's,
Okay, and this is quick, like I said, for patients. I usually will spray, though everybody says don't, but here we go. quick,
And
Miss
this is
Nora.
really popular with men because they wear those suit and ties, and when that tie kind of chokes up on their neck, it tends to overflow that neck area onto their collar. Now, Nora will be definitely having some of our arnica and bromelain to take home with her tonight, and that is
For bruising and swelling.
for bruising and swelling. It's an oral pill that you take that helps with the bruising and swelling. Some people don't bruise at all.
Like I said, I'm not doing a lot of Kybella for her. So I gridded her completely, but I'm not treating her the entire. Just I wanted to focus centrally. There we go.
How you
Miss
feeling,
Nora?
I feel fine, just
Perfect.
tiny little pricks, but
Okay, all right. Put
tolerable for
your
sure.
ice back on. You a little bit.
And you're all done with her Kybella?
I'm done with her Kybella.
Fantastic.
Okay, I have done her Kybella. So let's go through this one more time. Miss Nora, I have done your Juvederm in the nasolabial folds. I've done Voluma to her mid-face. I've done Juvederm to the corner of her mouth to bring her smile up and on her lips. And I've done Vobella under her lower lids to just soften up the transition between that top of the cheek and her lower lids.
And just for you
That is
guys
a
to have a
nice
visual,
transition for her.
there you can see. Cynthia, can you hold that?
Yes. Here we go.
Take the ice pack off, and
Bring
chin
it
down a
down.
little
There you
bit.
go.
There you go. You can see the difference. That light's casting a shadow, so everybody can see how it's brightened up, the before and after. Her corner of the mouth has really turned up. She's got less shadowing in the smile lines.
Nasolabial folds have softened up. The cheekbones. This is what
Oh
I
my
want.
God.
When you take pictures and when you get the light in your face, that it hits the top of your cheekbone and it radiates back. So now I'm going to have a little bit more of the contour, because a lot of girls will say to me, I'm tired of using my contouring brush or my blush. Now when you contour, you'll be able to see the light right in here. It'll just soften you up really nicely
And that
for her.
Kybella is going to give her more of a jawline
Right here.
definition because it's going to remove that fat pad and tighten the skin. This is an amazing transformation. It's
Perfect.
definitely a patch and an alternative to a mini facelift.
Definitely. So like Dr. Baumholt said, yes, we still have patients that are great candidates for facelift. But my patients that I think are in, I would say, late 40s going to 50s and say to me, hey, I'm not ready for a facelift, Cynthia, what can we do? This is something that we can work with. We can work with these products that are very user-friendly if you're well educated on what you need. Right now I'm putting a little bit of arnica cream. Products that'll give you lasting results for a year to 2 years, and if we maintain, we can keep that going. You see that the downtime for her is minimal. She's actually going to go back to work after she's done from this. Sorry, Miss Nora, we need you here.
That's fine.
Soften her up. When will she wear makeup? She can wear makeup in about 20 minutes after we're done. Nothing to change, actually. So what I did is I just did a little bit of the arnica cream on her face, just because I've injected these areas, softened her up. I'm going to probably put a little bit of lip balm for her to make sure she keeps the moisture there, and then we're good to go.
Awesome.
Miss
And
Jen,
we are offering complimentary consultations for a quote on all our products here. So you're welcome to make an appointment just for a consultation to see what you're a good candidate for or what we might recommend. Cynthia's amazing at knocking those out right away. And we can actually probably do the treatment same day,
Yes.
just depending.
Usually I will have time when patients come in, I block enough time that I can consult you, give you an idea, plan for you what we can do, make the plan out, and usually I accommodate and we can make the treatment that same day. Don't forget, like us on Facebook. Call us if you have any questions, 210-614-4320, Office of Dr. Delio Ortegon, and you met our lovely Dr. Michael Baumholt to our office. Our promotions that we have running right now. Next week we're going to be doing
ThermiSmooth.
ThermiSmooth is going to be a treatment that we can also do in-house in our spa with our
Esthetician
Amy,
or Monica or
yes.
MA for sure. It's going to be great getting ready for
Spring break.
swimming suit season. It will iron out any wrinkles on the back of your legs, on your tummy, any areas that you think might need some smoothing. And of course we have our Selfina in the back that will be viewing a couple of weeks out, so stay
Definitely.
tuned for that. And that does any indentions. You can
Any of the
see.
dimpling,
Yeah.
you see it on the cheek area of the buttock, and right above, right under that thigh, we could do that area.
And saddlebags.
Definitely. So that one will also want to see you for a consultation. The doctors will see you, make sure you're a good candidate. Same thing, we'll do a live stream with that, and you'll see how easy that is to tolerate here in the office. You go back to work a couple of hours to take the afternoon off, but we can definitely do that. It's one of our new great treatments we will do in the office. Okay?
Right, and you can always call and book an appointment to see the doctors for any type of surgery.
Yes.
We're running a promotion on all our surgeries for spring break, for the springtime.
Okay.
Alrighty.
All right. Well, thank you, Miss Jen. Like always, she's in the background. You can't see her.
Hi.
She's got her ashes on now. The rest of us will get to go for Ash Wednesday. Thank you so much for joining us. Again, 210-614-4320. Call our office. Miss Nora, now our new addition to our practice, can answer any of your questions, and if she can't, the
Absolutely.
rest of the staff will. We've got Lisa, our other surgical coordinator, our great medical assistants, Nicole, Monica, Elena. We've got Megan and Tanya at the front that also can answer any questions, and our lovely esthetician.
It's the A-team.
Yes. We're here for you. We're here to educate you. We're here to welcome you to our family. If you have any questions, please feel free to call us. Thank you so much, and we'll see you next Wednesday. Take care.
Bye.
You're welcome.